Very good morning to you guys. Welcome to Asake Online. This is the Breakfast Club. My name is Brighton Ncube. This show seeks to look at different issues happening in our various communities, from politics to health, from anything, climate issues. We touch on everything. If you have any stories that you want us to touch on this show, please do DM us to send us your feedback and a comment. We are willing to touch on that story. Today on the show, I'm joined by the Zimbabwe Alzheimer and Related Disorder Association. Friends coming through there to share more around issues of Dementia Awareness Week. I'm joined by Jane as well as Cherylynn to help me unpack this and understand more about dementia. Good morning. Welcome to the show this morning.
Good morning. Thank you, Brighton, for having us.
Thank you. Let's talk about Zimbabwe Alzheimer's and Related Disorder Association. What is ZADA all about?
So ZARDA is a private voluntary organization. It was started in Harare about 25, 26 years ago. Here in Bulawayo, we only started in 2018. The reason I got involved was because my mom suffered from dementia. And I just saw, it's actually the untold suffering actually of the carer and the families, because the person themselves, as long as their creature comforts are okay, they've got food and they're warm and everything else, and they're healthy, they're generally okay. But unfortunately, the impact of the disease, on the brain, for the family, it's very hard to try and accept. And I just thought, I've gone through a number of things in my life. I've also got a child that had issues when she was small. And it's always been my thing, like if I can try and help someone else not have to walk the same road, or make that road a little bit easier to bear. So that's one of the reasons why I got involved in this. And I got together with Brighton Ncube. You may have heard of her. She's an author and a teacher in Bulawayo. And her father also has the disease. Sadly, my mum passed away in 2020. Her dad is still around. And we started off initially as just a WhatsApp group on the phone. And we both said, no, this is not right. We actually you need the interaction with other people. Basically, it went from there. The Harare office had been down and they had done the initial talk with us. And so they did that in 2017. And Brian and I then, in I think about January or February 2018, decided to make it a more formal thing here in Bulawayo. And we went from there. We didn't actually have a committee till about August. And then we formed a committee and we've had quite a few ups and downs. Finance is a huge thing. We rely on membership. And the government also actually looks at us in terms of membership, which is actually quite hard because the people we're dealing with actually pass away. So unless the families or other people who understand the situation actually come on board and to be members and to continue to pay, because we just have an annual sub, which is $20 a year. And we do some other fundraising activities if we can, but the one thing we are really looking for is a corporate sponsor here in Bulawayo to come on board with us. I think, as you might find out in further discussion, we're discovering more and more that we need a home of our own for these people. It's very difficult to integrate them in other homes, and it doesn't sound great, but we have found that other elderly people who aren't suffering from this particular disease, they're not very accommodating and accepting. And when you're dealing with these people, you need a lot of patience, you need empathy, People need support, and you need a good sense of humor.
Allow me to bring Jane into the conversation as well on the issue of dementia, to go deeper into the disease and speak to us more about the disease, the causes of dementia. What are the causes of dementia, Jane?
Mainly, I would say in brief, depression is the major one. Loneliness, when people live alone and they've no one to share their problems with, they bottle up. And by bottling up, it's just suppressing and developing into something else. And the worst part is when they are lonely and they live alone, by the time you discover it, it would be very late in advanced stages, which is very dangerous. Whereas they always say the earlier it's discovered, the better, because you can manage the symptoms. And by managing the symptoms, it means you can delay the progression of the disease, because it's a progressive disease and it's a permanent disease. It has got no cure. But the care that they get can make them live longer and in dignity. So quality of life can be improved by the right type of care. And we have discovered that these people need more care than just medication. And if they get the medication without the right type of care, it's fatal. But if they get the right type of care, even without medication, sometimes they can keep going. So these are the major things.
Sharon, you mentioned earlier on to say at times they are put in the same place with other people. They're not considerate when it comes to this disease. Speak to us more in terms of partnership, who we've been working with in terms of keeping people with dementia, in terms of, are there any homes for people with dementia in Bulawayo so far?
There isn't a dedicated home. There's a couple of residential homes that some of them are living in. If they have gone in there already, then they're okay, and then develop dementia, it's fine. But some of them, well, to be honest, none of them really have the staff and that's required. So it does make it very difficult. It's one of the things that we've been looking at, is to find some way. You know, you want them to still integrate with other people, but there's three main stages to dementia, which I think Jane will probably go through. And the second stage, they can actually become quite violent and aggressive. And if you don't understand, you know, what's happening, you know, it can be taken the wrong way. It can blow up into, you know, quite a scene. You know, people could actually get hurt. The whole thing that you have to keep looking at with this is that dementia is a disease. You know, you've got to remember that this is a disease. It's not the person. You've got to try and look past the person. Some of the homes, they will take our patients, but we advise that they take a carer that has been trained. They must be trained in dementia care. We can't emphasize this enough. We have had incidents just recently where there have been problems where carers haven't had the sufficient training, and it can be detrimental to both the patient and the carer. So we run training sessions at the moment every two months, and we also recommend that if you are looking at carers, please go to a properly registered agency. Because I think there are a number of fly-by-night companies as well, and it can be detrimental.
Maybe Jane, as a counselor, speak to us more about the three stages that Cherylynn mentioned there. To say there are stages in terms of dementia. Take us through those stages.
The first stage, I would say, which is very rare to be picked or to be diagnosed, they lose memory, they get forgetful. And then the other thing that also happens is, besides the loss of memory, they become withdrawn. They don't want to mix with other people because they are aware of what's happening to them, which they cannot accept and cannot change. So by so doing, the people sort of like enclose themselves in their own, and they try and protect themselves from public people to notice that, even their own families, which is where we go back to the same issue of saying loneliness, living alone. Some people go through deep depression in those first stages. Like, for example, what would happen if I was to lose my spouse or my husband, and then my children have all grown up, they're outside the country, I'm on my own. There's no way they will stay with me until I get over the grieving. They will grieve with me the first few days, burial and everything. Then they fly away, they go to their own lives. Even if it is local, people go back to their own lives. Life still goes on. But it's me now who is left behind, who has to put up with myself and what I cannot grasp or accept. And as a result, I'll develop depression. The depression will get deeper. And with that alone, it means there's so many factors that will come up, rising from that. So while that is happening in my own environment, no one is there to notice and to see and to pick those things. And then by the time we say somebody has gone to a second stage, that's when people can now start picking those things. They can be picked because they will be progressing. Since it's a progressive disease, the symptoms keep progressing. So people can now pick. If I go in a crowd, which will be like sometimes a church crowd, then people will notice that she doesn't look the same. She's a very cheerful person, but today she was very moody. They changed moods. Their mood swings in the second stage. And also the forgetfulness increases. And also, they can blame other people from stealing from them. Why? Because they are on denial of their own condition. And they are trying to protect themselves as much as they can. So instead of exposing themselves or admitting to it, to say, I'm getting forgetful, I will now want to blame the next person that is next to me, so that I'm shifting my problem to that person. That second stage, they will now start saying, you have stolen my keys. Because they are forgetful, they can't remember where they've put those keys. They will now blame someone for stealing. They will not say, I can't remember where I put my keys. It will be like, you have stolen my keys. And sometimes it's not said direct to the person. If it's in a family setup, they will start whispering, targeting on those people that they think they can point at. And it can be very ugly and nasty. And that's where the stigma now comes in, because they cannot be accepted. The people will not be able to live with them under such circumstances. But to them, it's normal. They're trying to let themselves out now, because it has been happening. And I am aware this is what is happening, but I can't say it direct. Then when they get to the third stage, which is very dangerous, from the second stage there, they will start wandering around. They can lose sense of direction, lose sight, and most of the time they always want to go home. There's a common thing about them all. They will say, I want to go home, even if they are at home in the second stage. At a certain time of the day, especially when it's getting dark, because what will be happening in them is fear. They think, I'm in the wrong place. I should be somewhere. When they say home, actually what they are meaning is a better place than where I am. But the common word that they use is, I want to go home. So people do get confused when they're around them to say, what other home are you talking about? You are at home. So where else is home? So through lack of knowledge, people start getting them frustrated by, you'll be trying to say, you have nowhere to go. You are at home already. And that just upsets them. They get very angry. They can lose temper. They can be aggressive. That's second stage because of the attitude of people towards them, which can be very difficult. So there are so many to say, but in brief, I'm just mentioning a few. Then at the last stage, that's where they are actually bedridden. There's no choice. And that's where we need palliative care involved, because they won't be mobile anymore. They'll just be passive. They can just be there, but they are not there. Sometimes you even have to feed them. They can't feed themselves, but they still feel hungry. They want the food because the thought mind cannot put into action what needs to be done. So there again, but the body still needs to live. So this is where we chip in. I am a trainer. I empower carers. I teach them, I train them on how to take care of such up to the time of dying, and how to keep them going in dignity without having to be embarrassed, because they get to a stage in the final stages whereby they can walk around naked. To them, it means nothing. Everything is okay. But to you who is looking after them, you can pick it and say, this is not right. Sometimes they can even change clothes. The insides can be put outside, or turn around like I'm dressing this way. My jacket can go backwards to front, or swap shoes left to right. So in that case, this is whereby they suffer stigma, because the next person will now point and say, look. And then they feel it. They are very sensitive. They feel it, and they really feel offended. And the next thing they want to do to defend themselves and protect themselves, they get violent. They can hit you with anything. They can just pick this bottle, throw it at you. Whether they do harm or not, to them it means nothing. But they're just trying to express themselves. So in the trainings that we do, which is also part of awareness in ZADA, we specifically are trying to reach out to communities through caregivers, home-based care people, to empower them in the same way we were doing during the time of HIV and AIDS. Because with this stigma, people don't want to expose them out of families. And also remember, there are no hospitals where they can be kept. A hospital is somewhere where somebody could go with symptoms, get treated and discharged to go back home. When they go back home, this is still progressing, by the way, and they still need to be taken care of. Now, there at home, they need someone who is specifically trained and will be able to do the right job in the right way. So we empower caregivers, home-based care people. We empower and equip them with the right knowledge of the do's and don'ts, so that at least these people can be kept, well nourished, and also to live a normal life and quality of life to be improved. That's my main job. And apart from that, I do assessment of these patients while they are in their home setups or backgrounds, if ever we identify them. And we can only identify them through home-based care people, church people, neighbors in the communities, which is what as ZADA we are militating for, to say, let there be an awareness to everybody, even the doctors from their rooms when they diagnose. Can they please contact us so that we reach out to these people? We visit them in their environment. We assess them to say, can they be kept at home? Can they be moved according to their stages? Because they get to a stage where it can be very dangerous in a family setup. As much as we love them, we like them, but it won't be healthy to us. Sometimes it destroys the family setup. I'll give a simple example. For a man like you, you are married, you've got your young wife, and this is your mother who is now with this disease. That's mother to you. She's very important. You will not want your wife to mistreat your mother. And in your heart, mother comes first. But at the end of the day, your wife is also innocent, but she doesn't know how to handle mother. But you don't want mother exposed and taken out of your house. So how is your wife going to cope with that? So as a result, mother will start pointing, your wife is doing this, your wife is doing this to me. And you will be hurt. You're now blaming your wife. But after all, it's not true. And your wife cannot convince you enough. You will think she's defending herself. That's just a simple example for a family setup. So what's the result of that? You divorce, you separate. Your wife is hurt, you are hurt. And mother is still there. She's still going to live. She still needs to be taken care of. So what's the end result of that? So this is where we are saying, as ZADA, we are trying to chip in into that. If it's such kind of a family setup, for example, we would advise, if your environment is okay, then you bring in a professional carer who will be looking after your mother. That doesn't interfere with your own life and your own family. and your wife. And then if it doesn't happen in that sense, and we see she's in advanced stages, your environment is not suitable, this is where we are saying, should we at least have a home for these people where we can move them to? They can be taken care of until they die without having to be exposed in the way that.
But also, there is a very important issue there, Jane, on the issue of age again.
Yes.
Maybe Cherylynn can come and pitch in on the issue of age. Does it only affect old people, or now can affect young people? Also touch on the first stage. They can affect young people or only old people.
Generally, it's usually older people. Normally from about 60, 60 and above. But it's becoming more prevalent because of modern medicine and because of good food, nutrition, etc. So people are living longer. So that is why it's becoming more, more prevalent and obvious, to other people. But we do have, sadly, cases where it is affecting young people, drug abuse and alcohol abuse. There's one of the diseases is called Korsakoff's disease, and that is from alcohol abuse. We have identified cases in Bulawayo of about person of about 20 years old, this is very concerning. It's not something, anyone would want for their child, for their family. And we need to address it as much as possible, amongst the young people. They've also just recently done a study over, I think it was in the UK, and they've discovered that dementia affects children. The study was done in 2020, and they say that there's 700,000 children affected by dementia. And I think they said they've discovered 70 genetic causes for this. But that's as far as it's gone. They haven't gone, any further. So that's also, a concern.
I'm looking at the stats here. The international stats state that 2022, there are 55 million people affected by dementia, and 2050, the figure will have risen to 139 million. Let's speak to us more about that, Jane, on the issue of diet, perhaps. Suppose I have a mother, I have a father who's suffering from dementia. What should they eat in the first stage? What's the diet like? Should they eat in the first stage?
I would say briefly, balanced diet is the best. And also to avoid alcohol, like we are saying, and those things that would actually affect the brain. So a balanced diet, everybody knows what a balanced diet is. Yes, but at the end of the day, with poverty line today, it's getting a bit difficult. But we have simple things that we can make use of. Vegetables, they are cheaper. And if somebody could actually be encouraged on fruit, vegetables, fresh water for drinking, so that they don't get dehydrated, they don't get constipated, and they are well nourished. That's briefly what I could say. The right type of diet will determine the outcome of the health of a patient.
Cherylynn, besides the Dementia Action Week, right, what else has been you guys ZADA been doing in terms of creating awareness and making the public aware of this disease?
Okay, so yesterday we had a presentation with the junior doctors at UBH. We're trying to target the medical profession as much as possible, because we're also finding that when our dementia patients land up in hospital, they are not understood by the nursing staff. They're not understood by the doctors that actually receive them, say they're in A&E, and they're not quite sure, how to handle them. And the problem is, because it's a disease of the brain is quite fragile. And with these people, all the things that they are losing are the things that are learned. Okay, so you learn to walk and you learn to speak, and now they're already starting to lose these motor skills. And what we have found that's happened is when they get into a hospital situation, because they're possibly short-staffed and there can't be someone sitting with the patient all day and to be with them and walk around with them, because some of them, as Jane mentioned, they won't sit still. You know, they want to get up, they want to move around. It becomes an issue for the medical staff, and they generally sedate them. And that can also be an issue because in that process, once they come out of that sedation, sometimes their brain has degenerated further. And some of them will recover, you know, without too much problem, but then some of them will maybe lose, you know, how to speak further and how to walk. We have had that, you know, with one particular patient. And yeah, so it's just important that we get this out, you know, into our different medical hospitals, clinics, etc. This general awareness, just to save these people, you know, further indignity.
If you're just joining us, this is the Breakfast Club. I'm joined by our two friends from ZADA, that's Jane and Cherylynn, sharing more about the Dementia Awareness Week. Maybe as we close off the show, maybe Jane, to you, how can you break the stigma? I know it's difficult to accept this issue there. How do you break the stigma going forward?
The breaking of the stigma would start from the family levels, if possible. Be it me, I know my aunt has got it. Please, let's come out. They say a problem shared is better solved. Yes, people want to keep dignity, but you know what? Suffering quietly doesn't help. So you have to find the best way of coming out with it and speak either even to your neighbor. And we as ZADA are trying to reach out even in the rural communities. Like, for example, on Monday, we have got an outreach whereby I'm going to be training home-based caregivers and actually advising them on what to do and how to handle these people so that they don't just treat them as ordinary people, but give them love and proper true care. They just want to be accepted. The moment they know they are accepted despite their condition, they thaw up. The anger, the bitterness that makes them aggressive will go down. So these are the things that we are saying, please, let's come out, let's disclose. You can't disclose to the public, but even from the church level, if you've got your church pastor, church priest, or mothers who lead the church groups, you have anyone that you know within that community who is like that, please reach out and also reach out to us as ZADA. Then we will chip in and see how best we can help.
Sharon, in closing, briefly, you mentioned earlier on the issue of sponsorship, resources, you need for homes and so on and so on. Speak to us more about that. Then speak to the corporates watching the show today in terms of support. How can they support you?
Our two main wishes is to, one, have a home of our own for these people where they can live in dignity, in safety, and know that they're going to, and that their families know that they're going to be well cared for. The second thing is we'd love a corporate to come on board and financially assist us. At the moment, as I say, we work on a membership of $20 per family. And then, you know, throughout the year, we do some fundraising. But yeah, sadly, we don't get any assistance, you know, from government. So we are always looking, you know, for sponsorship. The one thing we do get donations every now and again of diapers from different places, and then we try and give them to our members. And then the other thing we've done is we work with Friends of Ngocheni, and we have adopted one of the ladies' wards in Ngocheni. There are 2 ladies' wards, dementia wards, and there's 1 gentleman's ward. So we've adopted the one, and as best we can, we try and help them, during the year, either with clothing or toiletries, and then at the end of the year, with Friends of Ngocheni, we try and with help with friends in the diaspora, give them a Christmas lunch. But it needs a lot more than just that. Our other month in the year where we do more awareness and everything is September. 21st of September is World Alzheimer's Day. And globally, they do memory walks, what we call memory walks. And so we try and, do that as well. And we did one last year. It worked. There was quite a lot of, what's the word I can use? We had a number of challenges before we could, actually get it off the ground. But this year, we're considering doing it at Hillside Dams, where we won't have a problem with walking out in the streets and all the costs that were thrown at us that we didn't even know existed. And we also have started a slipper flip-flop day, which we do on that day, where we target mainly the primary schools and the nursery schools. We found last year that the nursery schools all, wanted to come on board as well. So they go to school with their slippers and their slops, and they pay $1 for that privilege, and that $1 comes to us. And we found that has been working quite well. Unfortunately, we can't target the senior schools in that, because that 3rd term is a very important term with their school curriculum and their exams and stuff. So we are trying to work with the senior schools in the other parts of the year. But that slipper flip-flop day we do with the primary schools.
Cherylynn and Jane, thanks so much for your time, for coming through to Breakfast Club this morning.
Thank you for having us.
Thank you. Though we've been watching the Breakfast Club. This is Asake Online. I'm talking to Jane and Cheryl from Zimbabwe Alzheimer's and Related Disorders Associations, speaking to us more about Dementia Awareness Week. I hope you guys enjoy the show. If you have any comments or feedback, please do write to us, and we're willing to read your feedback and get back to you. Also, you can get in touch with ZADA. It's zada@zol.co.zw. It's www.zada.org, or get in touch with them on this number 0779 714 905. 0779 714 905. You can get in touch with ZADA. That's the number, right?
That's Harare.
Harare. Wula for Bulawayo? Okay, for Bulawayo is this one. That's 0717 544 223 or 0712 633 701. You can get in touch with S. Ndlovu there or C. Young. Hope you guys enjoy the show. For myself, Brighton Ncube, it's bye for now.